Hello everyone, welcome back to my channel. And in this video, we are going to discuss about the differences between FNAC and trucut biopsy. FNAC is basically fine needle aspiration cytology, and the trucut biopsy, both of them are medical procedures that are used to obtain tissue or cell samples for diagnostic purposes. Although they are used for same purpose, yet they have several differences. And let's discuss them one by one. Now, according to sample size and type, so in the FNAC, a fine needle is used to aspirate or suction out small number of cells or small tissue fragment, and it is primarily used for cytological evaluation. It means that it is used for examining individual cells. But in a trucut biopsy, we use larger and hollow needle to obtain core tissue sample. So it means that it provides larger and intact tissue sample for histological evaluation, that is examining the tissue structures. Now, according to purpose, in FNAC is basically used to diagnose and differentiate between benign and malignant, that is cancerous lesions. So it is particularly useful for evaluating superficial masses or lesions. And in the trucut biopsy, it is more suitable for diagnosing exact nature of the lesion. So it means that it can determine the grades and can evaluate the tissue architecture. It is commonly used to diagnose tumors and certain medical conditions. Now, according to invasiveness, so in the FNAC is basically less invasive, as you know that it involves thinner needle and usually it causes less discomfort and minimal scarring. Then in the trucut biopsy, it is more invasive due to the larger needle that we use in this procedure. So it may result in larger skin incision and more discomfort. Now the last is diagnostic accuracy. So in FNAC, it provides valuable diagnostic information, but it has some limitations in accurately determining certain tissue characteristics and architectural details. In trucut biopsy, it provides more detailed and accurate assessment of the tissue architecture, so making it a preferred choice when precise diagnosis and grading are required. Now, the choice between FNAC and trucut biopsy depends on specific clinical scenario and information required by the healthcare provider for diagnosis and treatment planning. You can register to my Max Online Academy and subscribe to my channel for more informative videos.